and we're going to finish in Australia. So really looking forward to hearing from all our speakers. And first we're going to hear from Shelley. So Shelley Solomon is a pelvic health physiotherapist with over 20 years experience. She currently works in private practice in Whangarei. Shelley sees women, men and children with a focus on pelvic floor, continence and pelvic pain issues. Shelley will be presenting this morning about incontinence in men. So kia ora and welcome, Shelley, and we really appreciate you taking time out from your busy clinic to join us, and especially on your birthday. So welcome, Shelley.
Look, thank you very much, Fiona, and yeah, thank you very much for having me. It's a real privilege to be presenting on this topic of urinary incontinence in men and representing the Pelvic Women's and Men's Health Special Interest Group of Physiotherapy New Zealand. Now, do I just need to share my presentation? Is that how I go here? Okay, cool. Let me just do that. Is that coming up okay? Great. So look, I thought I'd start with some stats for male pelvic health. Now, urinary incontinence not only affects females, it's not as common in men, but it is significant. Now, 1 in 8 men report problems with their pelvic floor, their bladder or bowel. Bladder symptoms affect 40% of men aged over 45 years, and an estimated 30% of men who visit their doctor have urinary incontinence, yet more than 2/3 of them do not report it. So this is a significant problem. Now, what are the common bladder complaints that may affect men? Now, if we look at incontinence to start with, which is the focus of this talk, there are 2 main types of urinary incontinence. Stress urinary incontinence is the involuntary loss of urine on effort or physical exertion, including things such as sports, sneezing, coughing, lifting, that sort of thing. Now, it's activity-related stress, it's not psychological stress. The next type, first I'll just chat a wee bit about urgency and lead into that. Urgency is the sudden, compelling desire to pass urine which you can't defer. And then urge urinary incontinence is the involuntary loss of urine or leaking associated with that urgency. So people will get this sudden desire to go to the toilet, to empty their bladder that comes on relatively out of the blue. And then that's the urgency. And then often in this situation, they rush to try and get to the toilet and they leak on the way. And that is the urge urinary incontinence. So these are the 2 most common types of incontinence. There are a few others, but these are the most common types. And you can have a combination of these types of incontinence, of both of these, stress and urge, and that's called mixed urinary incontinence. Some other bladder complaints, and if I just chat through frequency first, that's the term used for the number of times you empty your bladder during the day, during waking hours. Normal daytime frequency and an average sort of adult is usually suggested as going between 5 and 7 or 8 times during the day, or roughly every 2 to 4 hours. So often if you're going more than this is when it can become an issue. Nocturia is the term we use to describe the number of times urine is passed during the night. Now, it needs to be your bladder waking you up. It's not your partner snoring or the dog or the cat bothering you or children waking you. It's your bladder waking you up. Now, on average, we say sort of 0 to once at night is deemed within the realms of normal. So if you're getting up, your bladder's waking you up more than this during the night, that can be an issue. And then there can also be some bladder emptying problems. So hesitancy is where it's hard to get the flow started. It might be a little bit stop-start before it gets going. Or some people experience a slow flow where it takes longer to empty their bladder, or they may have real difficulty getting completely empty. And then post-micturition dribble is where you empty your bladder and you think you're all finished, but then some more dribbles out, which is really bothersome. It's usually before you have left the toilet. So these are some common bladder complaints that we'd see in men. Now, what might be the causes of these male bladder complaints? Now, the prostate is the most well known, and you can see it here in this picture as the round sort of grey part, sort of mid-screen here. I don't know if you can see my pointer, but this is the prostate here, but it sits below the bladder. So that the prostate can be an issue, but it's not always just prostate cancer, which is what is most well known. Sometimes the prostate can increase in size, and if it gets large enough, it will impinge on the urethra, the tube that the urine comes out, or on the base of the bladder there. This is known as benign prostatic hyperplasia, or BPH for short. Then, of course, the other prostate issue, which can cause bladder issues, is prostate cancer. Like other parts of our body, our bladder and pelvic floor change as we age and lose some of their tone and strength. So this can contribute to some issues in this area. Constipation and straining, as well as chronic coughing, will put strain on the area as well and weaken it, and can sometimes cause bladder issues. And the type and amount of fluids we drink can also have a really big impact on our bladder. So if we're dehydrated and we don't drink enough, our urine becomes quite concentrated and it can irritate the bladder, causing issues. There are also some well-known or some bladder irritants, and caffeine is the most well-known of these. But we also have things like artificial sweeteners and anything carbonated, so can sometimes irritate the bladder. Not in everybody, but and by carbonated, I'm not just talking about Coke and Sprite and those sort of things. Also any fizzy alcohols or even sparkling water for some people can be a bladder irritant. Some medications can cause some of these bladder complaints, as can some medical conditions. So urinary tract and bladder infections can cause these problems. Surgery, prostate especially, prostate surgery, radiotherapy to the area, then diabetes, Parkinson's, multiple sclerosis, as well as many others. So I put this in really big writing. These are common bladder complaints, but that does not make them normal. And your first stop should be to your GP to find out the reason. It's really important to find out what is causing these issues. Now, I can hear you all asking where on earth physiotherapy may fit in for these sorts of conditions. It's not something that traditionally physios are really known for treating. So what is a pelvic health physiotherapist? We're qualified physiotherapists with a special interest in pelvic floor muscle function and dysfunction. And we have postgraduate training and qualifications in pelvic health. And I guess where we differ from our other physiotherapy colleagues is that we're trained to do internal, vaginal and rectal examinations. Historically, we were known as women's health physios, as we really only treated women for continence and bladder issues before and after any sort of gynae surgery, and during pregnancy and after having a baby. But in more recent times, we now treat a lot more. Most of us go by the term pelvic health physiotherapist now. We treat bowel issues, chronic pelvic pain, sexual dysfunction, children with issues in this area, and of course also men. So like I said, we see men with bladder and bowel issues, with pelvic pain, and also erectile dysfunction. So what might be some physiotherapy treatment options for a man with these bladder complaints? Now, education is a huge part of what we do and is vital. Education on the condition, the anatomy, and men do have pelvic floors as well. So this is often a little bit of new information for the men we see. We educate on normal bladder and bowel function. These are things that they're not taught, and we often don't know whether we're males or females. And then on different treatment options in a plan. So lifestyle modifications are often very important with bladder issues and urinary incontinence. Like I've mentioned, looking at fluid intake, the amount and type, and looking for the different types of fluids that may be bladder irritants, because these can really irritate the bladder and make issues worse. And sometimes just adjusting the amount and type of fluid you drink can make a huge difference. Constipation and bowel management is also vital. The bowel sits very close to the bladder, and if someone suffers from constipation, that full bowel will really irritate the bladder and make any bladder issues worse. So we need to get those bowels sorted before we can really even make a difference to the bladder. So it's really vital to sort this out first. Of course, we advise on pelvic floor muscle training. First, again, it's education on where the muscles are and how they function, and then ensuring that they can be isolated and activated correctly, and then guiding with a strengthening or rehab program. And I'm going to go into this in a little more detail just towards the end of this presentation. We also give advice on returning to exercise, whatever that may be. And then for men with urinary incontinence, an incontinence clamp may be a useful tool during rehab for some men. And I've put a picture of one up here, an example of one here. And you can sort of see it opens up at the side, and those blue parts are kind of cushions. And you put the penis in the middle, about sort of midway down, and you gently close the clamp at the side. And it compresses the urethra, or the tube that the urine comes out of, and it can really help with leakage. Great for men after prostate surgery, where urinary incontinence initially is very common. There is a protocol that we recommend to follow with how to use this, and a physiotherapist or a continence or urology nurse with skills in this area is needed to guide the use of this, but they are easily available in New Zealand. And then, like I touched on earlier, and I just thought I'd pop this in because it often goes hand in hand. If men have problems with their bladder, they may have some problems with their erectile function as well. And there is some really good research that pelvic floor muscle training and strengthening these muscles can not only help with incontinence, but also erectile function. Following a prostatectomy, which is that surgical removal of the prostate, usually for cancer, most men will suffer with urinary incontinence and also erectile dysfunction. So a pelvic health physiotherapist can guide with penile rehabilitation to help with the earlier return of erectile function. Okay, so what is the pelvic floor? And yes, like I said, men do have one. The pelvic floor muscles go from the pubic bone at the front of your pelvis. So in this diagram, here's the pubic bone, and the pelvic floor muscles go from pubic bone here at the front to the tailbone at the back. And they're often likened to a sling or a hammock. It's that red area in this picture that comes sort of up under. Oh gosh, sorry, I've changed this picture and haven't updated this presentation. I'm very sorry, that's a female. Men don't have a uterus. Apologies there. So the pelvic floor provides support to the pelvic organs. It helps provide pelvic stability in conjunction with the lower abdominal muscles, and it helps stop leakage from the bladder and bowel. The pelvic floor has to relax in order for you to empty your bladder and bowel properly. And it also resists downward movement due to raised intra-abdominal pressure from above. And the pelvic floor also plays a part in sexual awareness and response. So they're often depicted quite simply like this in this diagram here. but they're in fact a little bit more complicated. It's not just one muscle. It sort of looks more like this. It's a pretty complex web of muscle, fascia, and fibrous tissue. And this is the female here on the left and the male here on the right. So just to finish off, I thought we could go through how to do a pelvic floor muscle contraction, and I'll give you some tips specific for men. So if you think of those muscles I've just explained in the floor of the pelvis, from your tailbone to your pubic bone, using imagery and various cues is really helpful when trying to contract them, because we can't see them as such. So it's not like other muscles in the body that are we can see easily. So imagine you are stopping the flow of urine, or that you're trying to prevent wind escaping, are a couple of common cues. Squeeze the back passage is a very effective way of contracting the pelvic floor for a lot of people, as most of us have done this from time to time. Bringing your tailbone to your pubic bone, maybe one, or a couple of good cues for men, lift your nuts to guts or testicles to spectacles. Shorten the penis might be another one used, but we usually find men prefer the other ones to this one. It's really important that the right muscles are targeted and that there is minimal accessory muscle use or movement. Now, I often say to patients, we could both be sitting here doing these now and the other one doesn't know. There should be no other muscle movement. Don't clench your buttocks, don't hold your breath, don't squeeze your legs together, and don't tilt your pelvis. So these exercises can really be done in any position, but you need to be comfortable and relaxed and somewhere that you can concentrate. It's not just doing a few here and there. You should feel a squeeze and lift, and then a let go and relax. And I hope you're all doing this now as I talk. An example of a program, and when we see people in clinic, we can examine and assess them and give them a pretty specific program tailored to where they're at with their strength and what's going on. But for example, we might say to start with 10 2 to 3 second holds and build up to doing 10 10-second holds. And when we're in a strengthening program, we're getting you to do this 2 to 3 or sometimes more times a day for men after prostate surgery. We'd recommend a bit more of that. As far as time frames go, the pelvic floor muscles are skeletal muscles, and they're trained and strengthened in much the same way as our other skeletal muscles. Now, I often say it takes 3 to 6 weeks of exercising these to notice a difference, but 3 to 6 months to get to full strength. And then once they're at full strength, it's not that you have to do these, and this is for men and women, it's not that you have to do these every day for the rest of your life. I sort of feel that's a bit depressing. But, you know, once you get these muscles strong, it is then a maintenance program of 2 or 3 times a week to maintain that strength. And then look, just finally, after prostatectomy, which is that surgical removal of the prostate, when we are teaching pelvic floor muscle exercises here, and we're specifically trying to help with bladder leakage in this situation when they don't have a prostate anymore, we do advise putting more focus towards the front when you're trying to strengthen your pelvic floor. So using those cues like imagining you're stopping the flow of urine, or the nuts to guts, or testicles to spectacles, as we want these muscles to really strengthen and come up and support under the bladder to minimise and prevent leakage. And that brings us to the end. Hopefully that gives you a little more information on urinary incontinence in men and where pelvic health physiotherapy fits in and can help. And thank you very much for having me. I hope that's been informative.
Kia ora, Shelley. Thanks very much. Yes, I mean, I never knew about pelvic floor physiotherapists before. So it was a really interesting talk. Hui, are there any questions in the Q&A for Shelley?
I think it's not for Shelley, some general comments. Why said, can someone order Mark Uber Eats for his lunch? Maybe it's a bit early for lunch. And Ben asked why there's no men minister. Can someone from the panelists answer the question? Why is there no men minister?
For men's health?
Yeah, for men's health.
Yeah, no, it's not part of the new 5 focus areas for Te Whatu Ora. Women's health is, but men's health isn't, so
Unfortunately,
got a way to go there yet. But Shelley, once more, just really like to thank you for taking your time out on the day. It was really interesting. It's an area that is probably under researched in terms of men's health. So thank you very, very much for your time. And hopefully